Laurel Stomanoff, CEO of the Urgent Care Association, or UCA, says that urgent care clinics handle about 89 million patient visits each year, which includes more than 29% of all primary care visits in the U.S. and nearly 15% of all outpatient visits. And nearly all of those visits are more convenient and affordable than a trip to the ER. The UCA's 2018 benchmarking report found that more than 70% of patients waited less than 20 minutes to see a provider at an urgent care center, and nearly 94% were seen in less than 30 minutes. Overall, 85% of urgent care centers' patients are taken care of in under an hour. The purpose of this presentation is to consider the feasibility of adding another urgent care clinic in Springfield, Missouri. Currently, there are 2 major hospitals within 20 miles of the proposed build site. Springfield, which is a city that's just barely over 80 square miles, is also home to 17 urgent care-like clinics. So ideally, we would be targeting a population outside of the city limits with this new facility. Here, you can see pertinent patient demographics. So for example, it's important to note that approximately 15% of the patient population is 65 years or older, meaning that they are eligible for Medicare coverage. That affects the pay and the income. Also recognizing that around 16% of Springfield live below the federal poverty line. And you also want to note that even for those who don't, they only earn around $50,000 annually. So this reiterates the need for more affordable healthcare services in this area. So considering the information we just reviewed, I propose to move forward with the building of a new urgent care facility here in Springfield. So despite there being multiple similar options available, there is clearly a need or a demand for the services, which can be received at a reduced cost, or at least a reduced cost in comparison to an emergency department visit. The principle of demand theory speaks to the relationship between consumer demand for goods and services and their prices. So as more of a good or service is available, the demand drops and so does the equilibrium price. Basically, this not only reiterates that the more clinics which are available equal lower healthcare costs, but also common sense says that the more opportunities or facilities for care would mean shorter wait times and also reduced healthcare risks with patients sitting around in the visit or in the facility. It's also true that this solution is financially feasible despite high upfront costs associated with a new building. The average urgent care visit costs approximately $176, whereas an emergency department visit may cost a patient over $2,200. And as I have already pointed out, there's an obvious need within the community, and providers would actively be engaging with new and reoccurring patients. Above all else, a consumer is going to look for convenience. So this means that patients would select this option potentially over one that was maybe further away, more expensive, had longer wait times, so on and so forth. So ultimately, you're not going to see patients not come to this facility. There will always be money coming in. Public policy is an important aspect of any business venture. Establishing a new facility here in Springfield is no exception and would require additional forethought and planning to ensure that each aspect is addressed. So while some of these on the screen appear to be a stretch, it's true that in the grand scheme of things, they really do all affect the overall health of our community. And of course, this is the same community which we intend to add another healthcare facility to, so they are applicable. For example, the creation and the regulation of public goods. I'm sure you see that and you wonder, like, how could this be related? It's simple. A perfect example would be the widening of roadways for bicyclists and sidewalks for walkers. So these positively affect the community's health. We take them for granted, though we'd wish they were available if we didn't have them, and those create healthier people. Regarding the regulation of natural resources, we want to ensure that this facility is as eco-friendly as possible. We want to protect the world in which we live, the air we breathe, so on and so forth. So, in closing, despite there being a few significant burdens associated with designing and executing a new urgent care clinic in Springfield, the long-term benefits really do outweigh the challenges and would ultimately serve as another option for receiving better quality, low-cost care.